We'll now find the landmarks of the patient's posterior pelvis. To begin, we'll find those iliac crests, which we already did once in the anterior pelvis, but we'll do it again from the backside as well. It appears the patient's left iliac crest is still high, and I'm measuring this by using the sides of my hands and using my dominant eye. Feeling down the patient's sides, finding those ridges, and then looking at which one of my hands is more superior. From there, we can move our hands back along that iliac crest to the backside, posterior superior iliac spine, or PSISs. These are very important for standing and seated flexion tests. I'm going to go ahead and go on skin like you do in those tests. So we palpate our way back from that ridge until we find those two bumps, one on each side. Once we find that PSIS, we can move our thumbs just immediately, just wrap our thumbs right around that PSIS into what's called the Sacral Sulci. There's a sacral sulcus on each side. This becomes very important when diagnosing the sacrum. So very slowly, like you're moving through cornstarch, you'll take your thumbs from the PSIS and just roll them immediately into the sacral sulci. After that, we'll find the patient's ILA, or the inferior lateral angle of the patient's coccyx. To do this, take your palm and palpate down the patient's spine to their sacrum and all the way down into their natal cleft, also known as the crack of their butt, and find the patient's coccyx. You'll then take your two thumbs and work on either side of that coccyx and see which one of these ILAs is higher or lower. You'll be measuring, or you'll be examining, diagnosing for which ILA is more superior and which is more inferior. As I just mentioned, the natal cleft is the crack in the middle of the patient's posterior. The gluteal fold is where the patient's legs come up and meet essentially their butt. So you can work your hand up here and it'll fit right into that crest, right into that crack right there. And lastly, we'll find the patient's ischial tuberosities. To do this, you want to work your way in along that gluteal fold, and you basically are hooking your thumbs onto the bones that the patient sits on. That's a good way to think about it, is the bones that you sit on are the bones you're trying to find.